I know that your fundamental point within this piece is that you want a royal commission to report on the NHS within a year of the next election. And that also depoliticises it because, as we find on this programme, the minute you talk about this, people adopt fixed positions. But what kind of things might actually move the dial here and kind of propel the NHS into the future, a future where it can actually cope?
Yeah, look, thank you. And there's a lot to celebrate about the NHS over the last 75 years, and it's really good to mark that during this week. But I think when we all look at the NHS today, and especially when we think about health outcomes, I think we have to be honest and compare it to other similar countries and say we've got to have better health outcomes. And you're right. Whenever this whole issue is discussed in Parliament, by politicians, it turns into political football. It's a very sort of toxified debate. There's what I'd say for politicians. There's almost they sort of lean into this narrative of adulation because that's what they think what people want to hear, without actually working out how can we get better health outcomes. And your question about what needs to happen, I think a good starting point would be to look at other countries. When you look at other similar sized countries that all have universal healthcare systems, be it Australia or Germany or France or Denmark and these places, comparable countries in many ways, all rich countries, all spending a lot of money on healthcare. We, by the way, are one of the highest spenders in the world on healthcare. I think 6 out of 33 of the world's richest countries. We've got to work out why they're getting better outcomes. How are their models different from ours? Why are people not waiting as long? Why are outcomes in cancer or cardiovascular disease generally better than what we're seeing in the UK? And I don't think we've got enough time to go through all that now.
No, but
that's why you need a royal commission.
Well, absolutely, Sajid Javid. But as a former health secretary, I bet you've looked at those exact systems and you've already worked out why they're getting better outcomes. So give us a clue.
I'll give you a couple of ideas. I think that their approach to prevention. So the NHS is very much, think of it as a national hospital service. It looks after you when you've become ill, and often really ill. And so there's a lot more that can be done as a country on trying to prevent that in the first place, or to slow it down. We know what the biggest killers are out there. It's obesity, it's smoking, it's alcohol, it's drug addictions. And other countries have a much more broader, joined-up approach to prevention. Another area is models of care. The other countries I mentioned earlier, they have different models. Some countries like Germany would have a social insurance model. Some have a contributory model. Some, like Denmark, has this model of fewer but larger so-called mega hospitals as a model. I'm not sitting here today saying each one of those is necessarily the answer for us, but we do need to look at why other countries are using different models and the outcomes that brings. And the last thing, if you want another example, is digital. A lot of the other countries, or all the other countries I've mentioned, they've embraced digital and innovation much more quickly, and they adapt new technology much more quickly. The NHS still has something like 600 fax machines. There's 80,000 doctors or nurses using pagers. I mean, there's some hospitals that are still entirely paper-based. And I think you'd be hard pushed to find that anywhere else in a comparable country in Europe. And by the way, it's not a question of money. We are, as I said, we are spending more than most rich countries as a proportion of our GDP. And already the NHS is something like 44% of entire government day-to-day spending, 44%.
Okay.
And you could put more money in, but you will not solve these problems.
Okay. I think you've said that patients should be charged for GP appointments and A&E visits. Would that be part of the future?
Well, look, I think what I want is for a Royal Commission, which is, by the way, is a body of experts and taking a cross-party approach, trying to take a dispassionate look at this issue. I'd want it to sort of come up with ideas. But you are right in that, if you ask me about me personally, and what I actually want to see to make it clear is a Royal Commission look at the evidence and make a proper assessment. Is that it is noticeable that in other countries that have universal healthcare systems that share our value, which is that everyone, regardless of means, should get the health care that they need, something I believe in passionately. But in those countries, in most other countries, for those that can afford it, they are asked to make a contribution, and that does provide an alternative source of income that isn't the general taxpayer.
Okay.
And I think that it's important to look at that as well.
Okay, we spoke to Johnny Mercer, the Veterans Minister, who says that he doesn't agree that privately Conservatives say that the NHS is unsustainable. He doesn't think a Royal Commission is the answer either. Why do you think a Royal Commission is the answer? Because governments often ignore their findings.
Because I think that it's clear that when the NHS is discussed in Westminster, that it does very quickly turn into this political football. I mean, that is obvious for anyone to see, and it stifles any serious conversation about its future and about how to make improvements. And in our country, in the past, when we've been in that kind of situation, something that is so important as this clearly is, that the whole purpose of Royal Commissions is that it is to have this sort of body that is taken away from day-to-day politics to report back. And ultimately, remember, whatever the Royal Commission comes up with, it's for the government of the day to decide. That's the democratic and the right approach. And other than that, I certainly can't think of another way to look at the NHS for the long term and make sure it's fit for the next 75 years.
Okay. I am really interested in, and I thought it was very striking that you said that privately Labour and the Conservatives concede that the NHS is unsustainable as it is currently run. And we've spoken to people on both sides today, and they both said that's not true. But maybe that goes to the point. That's just the point that you've made.
That's the point I'm making. That's exactly what you'll get today, right? You'll get any.
So are they fibbing? Are they fibbing, Sajid Javid?
Well, they're saying what they think the people want to hear, right? What they're saying is, I told you, there's a narrative of adulation, and they think that people just want to hear that everything's great, don't worry about it, isn't it all brilliant? When the reality is, what matters, I think, to people are health outcomes. What they want to be is they want to be healthier, and they want to live longer, and therefore they want the best health treatment. In an age where the burden of disease has changed, aging, society is aging. You know, when the NHS was created, there were 500,000 people over the age of 80. Today, there's over 3 million, and that number is rising rapidly. There's new drugs and new treatments that we rightly would expect. And we've got to have a system that can make sure people can get those drugs and new treatments. And so, you will get, I guarantee you get, most politicians on today, and they'll just say the same thing. They pretend everything's fine, especially over the next few days. But privately, they are not saying the same thing.
Okay, well, let's see if you can take some truth serum for the next question, Sajid Javid. Now that you're out with that political circle, can Rishi Sunak deliver on his 5 pledges?
Yes, I think if anyone, I think they're the right pledges. I think that if anyone can, Rishi Sunak can, but it's going to be tough, and he said that himself. If you look at the pledges, whether it's inflation, it's the boats, it's the NHS, they're the right things to focus on. And I do absolutely believe, and and you said take the truth serum and all that. I absolutely passionately believe there is no better person to lead our country right now than Rishi Sunak. There really is not. He's inherited a huge set of challenges. And if we want to get through those as a country, there's no better person, honestly, to lead us through that.
Okay. Finally, do you fancy joining Miriam Cates and Lee Anderson and the like with on the New Conservatives?
Look, I respect my colleagues. I respect those colleagues.
Sajid Javid, is that a yes or a no?
I won't. If you ask me, am I joining their group? I'm not joining their group.
Would you like to?
Because I don't tend to join groups, sort of small political groupings. I just don't. But the issue that they have been addressing recently, immigration, is an important one. I'm not sure how realistic their proposals are at all as a former Home Secretary, but I do think it's an issue that's worth debating, and they're throwing out some good ideas, and I think that's a good thing.